A 78-year-old lady is brought to the hospital ICU by her son, with complaint of getting unconscious at home, but was recovered after few seconds. She has recently developed severe constipation. She was previously prescribed oral medication for atrial fibrillation. Her previous medical history shows that she is the patient of hypertension. She has chronic obstructive pulmonary disease that is severe. No chest pain, no dyspnea. Her blood pressure is 108 by 62 mm mercury. Her pulse is 52 per minute. The examination shows the bilateral decreased breath sounds. Heart sounds are normal. ECG report shows second-degree atrioventricular block, that is the recent onset. Now the question is, which of the following drugs is responsible for her current condition? A. Lidocaine. B. Propranolol. C. Diltiazem. D. Amlodipine. E. Indapamide. The right option is C. Based on the information provided, the most likely cause of the 82-year-old man's current condition is diltiazem. Diltiazem is a calcium channel blocker commonly used for the management of atrial fibrillation and hypertension, and it can cause atrioventricular block as a side effect. Additionally, it also causes constipation as well as syncope. Syncope can occur because diltiazem slows down the conduction of electrical impulses through the heart, which can result in a slower heart rate and decreased blood pressure. These changes can cause decreased blood flow to the brain, leading to fainting. Second-degree atrioventricular block occurs because diltiazem slows down the conduction of electrical impulses through the heart, including through the atrioventricular node, which is responsible for transmitting electrical impulses from the atria to the ventricles. When the conduction is slowed, some electrical impulses may not be transmitted, leading to AV block. Constipation is a common side effect of diltiazem because it can slow down the movement of food and waste through the intestines. Bilateral decreased breath sounds can occur in patients with chronic obstructive pulmonary disease, COPD, taking diltiazem because the drug can cause fluid accumulation in the lungs, leading to worsening of the patient's respiratory symptoms. Lidocaine is a local anesthetic and antiarrhythmic drug, but it is not commonly used for the management of atrial fibrillation or hypertension, which are the conditions that the patient is being treated for. Lidocaine is generally not associated with constipation or atrioventricular block, and is not the most likely cause of the patient's symptoms in this scenario. While lidocaine can cause cardiovascular side effects, such as heart block, these effects are usually seen in high doses given intravenously for the treatment of life-threatening ventricular arrhythmias, and not in the oral doses used for treating atrial fibrillation. Amlodipine is a calcium channel blocker commonly used for the management of hypertension. However, amlodipine is not typically associated with causing atrioventricular block or syncope, and it is not a commonly used drug for the management of atrial fibrillation. While amlodipine can cause peripheral edema and constipation as side effects, these symptoms are less severe and less frequent compared to the symptoms being experienced by the patient. Therefore, amlodipine is less likely to be the cause of the patient's current condition compared to diltiazem. Propranolol is a beta blocker commonly used for the management of hypertension and various cardiovascular conditions, including atrial fibrillation. While beta blockers can cause side effects such as bradycardia and heart block, they are generally not associated with causing atrioventricular block of the degree seen in this patient, new-onset second-degree atrioventricular block. Additionally, propranolol is not typically associated with constipation as a side effect. Therefore, propranolol is less likely to be the cause of the patient's current condition compared to diltiazem. Indapamide is a thiazide-like diuretic commonly used for the management of hypertension. Indapamide is not typically associated with causing atrioventricular block or syncope, and it is not a commonly used drug for the management of atrial fibrillation. While indapamide can cause constipation as a side effect, this symptom is less severe and less frequent compared to the symptoms being experienced by the patient in the scenario. Therefore, indapamide is less likely to be the cause of the patient's current condition compared to diltiazem. Subscribe to our channel for more informative videos.